I think there's a sense that accountable care and pioneer ACOs are designed around primary care, and there's been a big emphasis on developing a medical home or patient-centered medical home. But hospitalists are an integral part of that. And I think the point that we've tried to make is that if you look at these core measures around the patient experience, documentation, reconciling discharge meds, the appropriate medications, immunizations, those are all hospitalist-related work. And it's a big part of it. We know the hospital experience is the most expensive part of healthcare. And we know that a big part of accountable care is transitions of care, and this has been a focus for hospitalists for years. So I think hospitalists are front and center in terms of how accountable care should work. And I think part of what we've tried to describe is a model in which we have to get much better at the collaboration that happens around primary care and hospital-based care. How do they get a seat at the table? You know, I've been a strong advocate for hospitalists getting involved in things in addition to clinical care. Whether it's leadership or being involved in quality or value or a whole range of areas, that allows you to get a seat at the table to be able to say, as we engage with medical home, how can we also engage with the measures that we're asking our hospitalists to do, and so that they feel part of it. A lot of this is engagement and validating the work that people are doing. We've been incentivized and asked to do work for what we thought were the right things, and sometimes they're the right things for profit. Sometimes they're the right things for quality, and this is a new way that we can have joint goals around how we do things.
Well, I think all of the pioneer ACOs have tried out different innovations in order to see where they can save costs and improve quality. And so at Banner Health, we have tried several different areas. So as you mentioned, working in the ED alongside emergency physicians to try to find the best location for patients. We've also looked at, we have a transitionalist model at my hospital who follows patients at home. There are lots of others. We have physicians who work as care coordinators in the hospital, so on a bigger scale, looking to find best resources for patients when they leave, how to get patients out of the hospital safely and effectively.